Well, good evening, everyone, and welcome to the Brian Crombie Radio Hour on Saga 960. So probably other than restaurants, maybe the group that have been most impacted by COVID-19 and the closures are athletic clubs and gyms. And so I did a show, back before COVID-19 even started with Movati and wanted to see what was happening with them because they opened up a big new club in Mississauga. I wanted to check back in with Movati and find out, what was happening now. And I've been joined by Chuck Kelly, who is one of the founders, one of the 5 founders of Movati, started in Windsor, expanded to Toronto and Ottawa, and the CEO of Movati. Chuck, welcome to our show. How are you, sir?
I'm good, Brian. Thank you for having me.
My pleasure. So tell me, maybe just to start with, how many Movati athletic clubs do you have?
So currently there's 17 in total in Ontario. We're building the 18th in Edmonton as we speak. And it should open in the summer of 2021.
And you've got, they're fairly big, but they're not as big as, Big Lifetime so that they're sort of, what would you call them? Almost big or mid-size or what?
No, they're large format fitness clubs. There's 70, the one in Mississauga is 70,000 square feet.
Okay.
A fitness area. We range, some of our early clubs are around 30,000 square feet, up to 75,000 is our largest in Ottawa.
But your difference is that you are sort of like a accumulation or a combination of a bunch of different boutique studios that sort of fit together. Is that not correct?
That's correct, Brian. I always jokingly say that we're a bouquet of boutique fitness clubs.
A bouquet of boutique fitness clubs.
Yeah. So as you come in, we have a ladies only pool, ladies only aerobics. We have a functional training area. We also have 2 yoga studios, spin studio, and we call our fuel room, which would be like a small group training, aka like people may be familiar with a Greco or a Orange Theory, but we have a Movati version.
Okay. And I think it goes without saying that COVID-19 has been tough on you, but tell us exactly what the impact has been.
So from the beginning, Brian, when we started and we got locked down, and I believe it was March 17th, we closed a day earlier or before. We were all in a holding pattern waiting for the government to open us. I think our first club opened on July 27th, and the final one got open due to the lifting of regulations in August. Since then, we've been operating with a team of professionals that have provided a safe area to work out. Movati to date has had 903,000 workouts since that date across Ontario. And up to any of my knowledge from any of the health units, we do not have any spread of COVID from those workouts.
903,000.
3,000.
And not one infection. And yet you're being forced to close down.
That's correct. We have been trying to communicate with the government to give insight. It's been difficult, albeit it's been difficult on everyone. So I understand the government has an unbearable burden with no real plan. No one had a COVID plan or a pandemic playbook. So it's what all we want to do is be part of the solution. I got into this business. I was a paramedic because I wanted to help people. I believe Movati provides an environment for people who have an outlet to be proactive in their health. And if you can do it safely, which we've proven with our data, that we have been operating safely due to the work of our great teams, we believe it should be an option for people in Ontario to get rid of COVID fatigue. In fact,
I couldn't agree with you more. We're chatting tonight with Chuck Kelly, who is the one of the founders and the CEO of Movati Athletics. We're going to take a break for some messages and come back more with Chuck and understand exactly what Movati has done to have, 903,000 workouts and not one infection. And
we have not been made aware by any health unit of any spread in our clubs.
And they're still being forced to close down.
That's correct.
Stay with us. We'll be right back in a minute. Welcome back to the Brian Crombie Radio Hour. We've talked to restaurants. We've talked to small businesses. We've talked to big businesses. We've talked to live entertainment. all that have really suffered during COVID-19. And, I can completely understand that physical distancing, not social distancing, because I've argued on numerous occasions that the language we used of social distancing was wrong, and it probably caused some problems. We needed to stay close to people from a social standpoint, but we need to be physically distant from them, 6 feet, and gyms. And I wanted to reach out to Movati, an organization that I had interviewed back before COVID-19, as they opened up a huge new complex up in the north end of Mississauga, a beautiful complex with a whole bunch of different facilities, about what they've been doing. And we're joined tonight by Chuck Kelly, who's one of the 5 founders of Movati and the CEO of the organization. Chuck, you said that you came from a paramedic background.
That's correct. I was an ALS paramedic for the city of Windsor for 16 years.
And so, when you're talking about putting in place some of the measures that you put, you've got a practical experience with what one needs to do, I would presume.
So I'd like to say there's a lot of experts out there, Brian. I don't proclaim to be an expert, but I do have a pretty sound background to understand transmission modes. So with that being said, Movati, when we were building our protocols to reopen, we were leaning on some of that knowledge with PPE and air quality and aerosolization of a virus. So that helped formulate, working with the teams who did an amazing job to get us open and to get all the protocols in place, train our also amazing team to come back so they could be safe. We would not be open, Brian, if I could not keep my team safe first, second, our members, and third, the communities. We've been in these communities, some of them for 25 years, and we want to stay in those communities and not harm anyone. So,
yeah. What did you do from a ventilation standpoint?
So Movatis are unique in that they're built from the ground up, our clubs. And when we build a club, they have high ceilings. The ceiling heights. So I'll give you an example. If we're going to engineer our spin studio, the engineer sits back and says, okay, what's happening in this room? You're going to have up to 35 cyclists or 40 cyclists in this room at once, creating so many heat units, exhaling so much CO2 and exchanging air. And what type of air ventilation do we need to keep this room fresh and from that standpoint safe? So right from the beginning, the club was built to create good air exchange. Movati, our spin studio, exchanges the air, complete tidal volume of that room. It exchanges the air 8 times an hour. So once every about 7.5 minutes, the total tidal volume in that room is being exchanged. With COVID, we know it's aerosolized. So as you build a viral load, if you don't have good air exchange in the room, then you're going to have a problem. So what we did was we went up on the roofs, we worked with our team and our engineers and said, okay, what's the maximum amount we can open the air exchange units so that we're buffering with outside air as we're bringing in and circulating or heating or cooling that air. And while we were doing that, we added an upgraded filter it's called a MERV 13, so MERV. And that is the highest quality of air filter till you get to HEPA filter. So it's a in between a hospital HEPA filter and a normal unit on the roof. So we understand that social distancing is part of it. Cleaning and wiping things down and spraying them down is another part of it. And a third part is the air exchange that happens in a building. So
I had an HVAC expert on my show, and he was saying that the typical institution, school or something like that in Ontario, has 3 atmosphere changes or so per hour. The best ones have like 5 atmosphere changes per hour. And he said airplanes, you don't need to physically distant because their atmosphere changes per hour are greater than 10. And he said that you need to be exposed to the viral load, the infection, for about 15 minutes. And so 3 would be every 20 minutes and 4 would be every 15 minutes. And so that's bad. But if you're below that in time and above that in 4 times per hour, then the chance of infection goes down dramatically. And he thought that, the 10 which is in airplanes, which is effectively every 6 minutes, is such that that the chance of actually getting the virus is extremely low. And then he also commented about the use of the filters that you're talking about, and that being critical. But he said the problem was government's not listening to that argument. What's been your experience?
I would concur with them there. So, and the problem is not enviable. They're facing so many places, and I'm not picking on it. If you open up a sub shop, they take over a secondary space. They probably did not spend the money on ventilation or had the sophistication yet in their business model to understand what they were doing in that unit. So at Movati, because we engineered it for a specific purpose, we have over-engineered compared to most places. So all to say is, if you're in one of our studios or in our clubs, we're exchanging the air based on a capacity of people who would be exhaling. They'd also be creating heat units in the room. So the units and the function of the HVAC was designed to take what we were doing into account. Many places, and I'm not criticizing anyone, many places that is not the case. If they take a secondary space and they retrofit it for a business, it could be a restaurant, could be an office. Did they take into effect what was going to happen and modify their HVAC units?
What about the 6 feet distance? Have you implemented that?
We have. We've moved equipment. We've also went to 9 feet, Brian, in our clubs because they're all in orange. Or we have, I believe right now, 10 clubs that are open, and 8 of them are in orange and 2 are in red. So once you step forward in the different phases of restrict from green, yellow, orange, red. In orange, you have to be 9 feet apart. So our studios were set up so participants would be 9 feet apart, limiting to 10 maximum in the room.
And what about masks?
Masks? Well, that's an interesting topic, and you could get me really going on this one. So masks, I think, are a good thing. Movati implemented it everywhere except when you're on a cardio machine, you can take it off to run, walk, or jog. And when you're in a class, if you're participating in a group fitness class, once you get on your designated spot, which is marked in the floor, and the instructor comes in, they will ask you if you'd like to remove your mask. You can. One of the biggest problems, Brian, is what I like to refer to as the ground truth in life. So the government put out the regulation, and it's sound, that everyone should wear a mask. But there's a little clause in there that says, unless you have a pre-existing condition, health condition. I can tell you early on, what was spreading faster than COVID anywhere in Ontario was that. And our teams were dealing with people who were flaunting the rules. So for their safety, Brian, Movati took one step forward and said, no, if you want to come in our clubs, we want you, but you have to wear a mask. There's no exemptions at Movati because we are trying to keep our teams safe first, members also safe. So we took one step more than the government was with the regulations to make mask mandatory inside when you're lifting weights or moving around our club.
And so you've got 6 feet or 9 feet worth of separation. You've got very good ventilation. You've got mask usage, and still you're being restricted in some of your gyms.
Yes, we are currently closed. And one of the most frustrating parts, Brian, is for my team. My team, they've done everything that anyone could ask and more. And to see them out of work, and we're in a position where in zero revenue, I'm not asking for empathy. It's just, what can I do when I'm at zero revenue, when I'm shut down? Let us stay open. We proved we can do it safely, put the restrictions on us. But for some reason, we've been clumped in to this super spreader. Now, I have had discussions, Brian, with our sector leader, so the sector who's in charge of physical activity for the government of Ontario. I'm not going to say his name because he's a nice man, but we've been lumped in with sports and recreation. Now, I have nothing against, and I'm going to use some of my history. I played sports and played hockey as a young kid. We've been lumped in with sports teams. Now, I don't know any hockey dressing rooms you've ever been in, but they are definitely not sanitized nor fresh smelling when you go in them. So, yes, they are a part of, I guess, fitness, but our industry should be separated from that percentage of infections, because if I watch the media, I've seen far more outbreaks on sports teams than I have ever seen coming from the health and fitness industry. It's just a different way of doing business.
The head of infectious disease for Massachusetts General was interviewed today, and I think this individual has been nominated by the new president of the United States to be the head of the CDC. And it was interesting because what she said was, everyone's waiting for this vaccine, and clearly it's going to be important, if not critical, to the world getting back. But to think about it just for a second, if you're 6 feet apart, the chance of you actually getting the virus is extremely low. And you're 9 feet, so you're even more protected than that. And then she said, and if you're within the 6 feet distance, the mask will help you from either spreading the virus and or getting the virus. But think about the vaccine. With the vaccine, you're getting the virus, and it's in your nose. You're just not getting so much of the viral load that it'll overcome your antibodies. Hopefully, your immune system will kill it. So you're actually getting that virus in your body, but you're relying on the vaccine and the antibodies within your body, the infection, the immune system, to kill it off. But we don't know yet. You still might be able to spread it. So people have been hoping for this vaccine, but we've got two things that are actually more powerful than the vaccine available to us right now, but we're just not doing it, which is 6 feet of distance and masks. And you're doing that. And you're still being forced to close.
And I have, Brian, I'll fight all day for my teams. I've been a very fortunate person, in my life, and I've been surrounded by amazing people. And when I wake up in the morning, I'm motivated every day to get them back to work, because we've proven we can do it safely. If this was the beginning, Brian, it was just, there was no data, right? Let's go back. Here's what we think will work, right? When the government set out these regulations, we implemented those regulations and went beyond those regulations as an industry. And here's what we can show you. We have data. Now, I'm speaking to our data only. Now, I am part of the Fitness Industry of Canada Council, and I know there's been well in excess of 20 million visits across Canada since we reopened in July, or some provinces in June. And there has been a fraction of spread coming from health clubs. Movati's is unique because I can speak to it. It was 903,000. And to date, we've not been made aware of any spread. I want to emphasize this. I was a paramedic. I got into this business because I loved it, and it was positive, and it was health oriented. And all we want to do is give people an option out there that's not retail therapy. It frustrates me every day, Brian. I walked out of the club in Amherstburg that's still open in red with 10 people. And I walked over to a dollar store, and I counted 48 people in about a 2,000 square foot building. It floors me, like that the government will not give people a proactive option to release stress and be proactive in their health, not just.
Well, I think this is a major issue, and we're going to take a break for some messages. I want to come back and talk to you a little bit more about mental health, because I think that is one of the things that we've neglected. And I think it's after our public health crisis and our economic crisis, it is the third crisis that we're going to have to deal with. We're going to take a break, come back more with Chuck Kelly in just a minute of Movati. Stay with us. Welcome back to the Brian Crombie Radio Hour. Very interesting conversation that we're having tonight with one of the founders of Movati and their current CEO, a guy by the name of Chuck Kelly, who is a former paramedic and spent, was it 18 years, I think you said, Chuck, on the Windsor?
16
years as a paramedic, and then started Movati. One of the reasons why was to try to really improve people's health. Chuck, I wonder about mental health. The statistics are that divorces are up, that alcoholism is up, that drug abuse is up, that people are really having difficulty with what's been going on. And, it's a combination of concern for themselves, concern for their families and society, the fact that they're socially isolated, the fact that they're staying at home, they're not out and interacting with people, they're not traveling, they're worried about, so many things that are impacting them. They're stressed with their kids at home and homeschooling, or if they go to school, and will they get sick at school, and how are their elderly parents doing that they haven't seen them. And then, on top of that, all that, back in the spring, the government in their wisdom closed a bunch of their parks. They actually didn't close the parks. They say they closed the parking lots for the parks. But what it did is it restricted people's ability to go and enjoy the parks. And I don't think they're doing that now, because they realized that was dumb, that what they were doing is they were robbing people of the opportunity to get out and enjoy. And I've been into a bunch of the parks, not down in your area, but around the GTA. And, people, when they're walking down paths, they divert away. They're trying to stay 6 feet away from people. Even when you see people, out having a barbecue, you can see that they're physically distanted from other people. So I think people are respecting that. And I really worry that comparable to this sort of overreaction by closing the parking lots for parks and trying to get people to stay home completely and not even get out and get some vitamin D and fresh air and oxygen, that this closure of gymnasiums, of athletic clubs, of yoga studios, of dance studios, of sports facilities are going to take away people's mental health. They're going to negatively impact people's mental health, because people need to get out and exercise.
I agree, Brian. And this is a very difficult time of the year, even without COVID, for many people with mental health struggles. I used to see that in my former profession. It always got busy around Christmas with people suffering from depression and other issues that are magnified by the holiday. When I speak to people, my team and our members, and just people in general in the community, they have COVID fatigue, because there's nothing they feel they can do besides go to a shopping center. That seems to be okay. But I think with statistical data that we have, that we can be part of a solution. It's not the entire solution by any stretch, Brian, for mental health. But for many, it's a great way to release stress, be positive, feel they're being proactive against an anxiety they have for COVID or illness, and it's being taken away for, at the beginning, what I would believe was a good reason, and now with all the data we have to show that it can be done safely, that it should be allowed. And I'm not advocating to go to full no restrictions, but in the beginning, we've proven from green to red to orange to yellow, we've operated in them all, that we've continued to keep people in Ontario safe, which is, we share that. I say it again, Brian, I would not keep my doors open if I did not feel my team was had a safe environment to come into. Like, this is about safety, and our data proves it can be done.
Why isn't the government listening to you? What's gone wrong here?
Well, I have spoken, Brian, to every level of government, right from the premier to many people that work underneath under him in the government. They are hesitant, and many MPs that I've spoken to federally, especially the federal MPs, they're very hesitant, because they have told me that, until our narrative changes that we're a dangerous activity, they feel, I've asked them to champion our data, for us. I thought, here, I'll give you the data. I'll even have it verified by PwC if you want, just so you know I'm not falsifying anything from our software. And all we want you to do is push it forward that we are an alternative that is safe to use as part of this. I cannot, so we'll just, Brian, for argument's sake, 20% of the population works out in a health club of some sort. Could be a little higher, somewhere in that number. To those 20%, it's often the thing that keeps them centered. It's the activity that brings balance to their life, whether it's yoga and lifting weights, running. It is incredibly important to those people. And the other 80%, unfortunately, if they don't use physical activity currently, they feel it's a compromise. Well, we just got to keep everybody safe, right? So we're kind of caught in this area where I wouldn't want to say we're dangerous, and because we aren't, but we're expendable because 80% of the population doesn't go to a health club at any, currently. Right now, more, but that's typical in our industry. One of the other things, Brian, I think that needs to be said is there's been a lot of damage done to our industry by political leaders speaking and medical professionals. And if it's not true, they need to back away from it a bit. And in the beginning, with airplanes and airport travel, if you noticed in the last few months, I haven't heard anything derogatory, we'll say, towards that industry. Anybody speaking like it could be dangerous, but which I appreciate. I just want our politicians and medical communities to acknowledge we are doing this safely so that the populations in our communities understand that we have been operating and functioning in a safe manner, and our industry is safe.
Well, I agree with you, and I think that your comments about good ventilation and 9 feet of distance and mask usage should be compelling. And the most compelling should be that you haven't had any infections out of the 903,000 people that have been coming there. And I come back to, I am very worried that we're going to have a mental health crisis, and suicides, alcoholism, drug addiction, et cetera, are on the rise. Opioid addiction and deaths is on the rise. And some people would argue that, frankly, we've had comparable numbers of deaths from addiction and or from suicide that we have had from COVID-19, and yet they haven't been getting the attention and haven't got the media to clamor about it. What about a policy that said you can open with the measures that you've put in place, but if you get an infection in one of your gyms, or maybe it's 2 infections, you got to close, and you got to close for 14 days. So effectively comparable to what they're doing with schools, which is, you can keep the school open, but if some class gets infected, that class has got to go be isolated for 14 days. What about some sort of definitive rule that says, and which gives the incentive to you and others to put in place good measures? Because right now there's not that incentive because it's a blanket rule that applies to everybody. So
that's a good question. And if you were to think about that, if the transmission was if the health unit could understand the transmission came from our club, so there was somebody had come into our club and spread it to others, then yes, we would be wholeheartedly, if that was to close down for 14 days and then reopen. But one of the problems that's happening, Brian, right now is there are people going into every business who test positive 4 or 5 days later, and then the health unit will call you and say, there was somebody in your facility on this date between these hours. Now, one of the blessings of fitness clubs, especially Movati, but most, 98%, we have a tracking system. When people come in, they swipe in. I actually have all their contact information for tracing. I know what time they came in. I know who else was in at those times. And I have the ability to immediately contact them either through text, email, or phone call. Now, I can't speak to any other big box retailer or industry, but I think we are the gold standard when it comes to tracing. So if it was to happen, I feel within, being notified of it, within a few hours, my team would have contacted anybody who would have been in, God forbid, if it was to happen in the club, and we would be able to trace it. So, that's another thing that no one speaks about our industry. But really, can you think of another industry that knows exactly who came in, when they came in, and who else was there? I mean, at Movati, outside of the locker rooms, I could watch them on cameras and follow them through the club and see if they actually spoke to anybody.
One of the unintended consequences of this restrictions that the governments have put in place, I think, is that we forced people that might have been more widely distributed around the province to concentrate in specific, areas and locations. And it's, shopping malls and big box retailers that are, not closed down. You made the argument about your dollar store. I was in a liquidation store that I guess somehow gets around the rules about being a essential service, because they sold a little bit of food, even though the food was frankly out of the expiry date. That why it was in a liquidation center. It was packed with people. And I don't think there was much physical distancing in there. I drove into Halton on the weekend, and the malls there aren't closed, unlike in Toronto where they are. Packed parking lots, and the retail stores packed, and the restaurants packed. And they were complaining that they had to turn people away because too many people from outside of Halton were coming to dine there. So we're by definition, as we close down some places, we're forcing people to concentrate in the places that are open, aren't we?
Yeah, I mean, Brian, to my understanding, until they came out with this red restriction on retail, there has been no restrictions on retail from the day one on occupancy. So other than their total occupancy that they got when they got their permit to occupy their building. One of the big frustrations, now you mentioned Lifetime, the Movatis, and the Good Lives of the larger format clubs, is it's not based on square footage. It's 10 in a building. Well, I have a 75,000 square foot building in Barrhaven, or 70 in Mississauga, and 10 people in there, you could play hide and seek and not find each other for a week, okay? So it makes this common sense
per room, right?
It's which?
It should be maybe 10 people per room.
Yes, or base it on square footage, because 10 people in a yoga studio and 10 people in a 70,000 square foot Movati are two different animals. So right now, my understanding of the red is retail can have up to 30% of their total occupancy, like given by their square footage. That was one of the things we argued, and we put forth cases that to our government that we should be based on square footage, should be calculated somewhere in this formula, or your total occupancy you were given when you were given your permit to operate.
What do you think's going to happen, Chuck, to the industry? You're a big company, you may survive, but aren't there going to be a lot of athletic clubs, gyms, yoga studios, dance studios that go bankrupt?
Absolutely, Brian. And let's get even like one step to the real heart of fitness is our team members. Our team members are suffering greatly in this, and they've done an amazing job at keeping people safe, including themselves and others in our facility. They've went above and beyond in the industry. It's a very passionate industry, whether it's Movati or Orange Theory or Lifetime. A lot of the people that work in it want to help people and love what they do. And they have impacted them, and they're looking for other careers because they don't feel it's as stable or safe as it could be. Will fitness rebound? For sure. Like, I don't have any doubt that it will. But the price in between, there's a dollar figure, but dollars can be made like back. But people are different. And I've been fortunate, like I said, to be surrounded by caring people, and I fight for them every day. I feel I let them down because I cannot get the government to listen, that we can operate. Here's the data. You show me your data, because I have empirical numbers that you can't really refute because they're real. Showing me a fictitious number of 3% came from recreation, or I'm not saying it's fictitious, but there's no breakout of where it came from. Was it a sports team? Was it soccer league? What did you compile in this? Because we should not be being compiled with recreational sports. I have nothing against, people should be active, keep doing it. But our industry is being unfairly marginalized right now. It's impacting the people, and that, like I said, if you want to get me going, it's for my team.
Pleased to get you going today and hear what you have to say. Chuck Kelly, CEO of Movati. Thank you so much. I agree with you completely. I think it's going to impact your team members. I think it's going to impact your fitness members. I think it's going to impact their mental health negatively. I think it's going to impact the industry, and I think it's going to impact the province. I think that we are not going to be as healthy, whether it's mental health or physical health, in the future, because we're taking the wrong action here. We're restricting people too much. Masks make sense. Physical distancing makes sense. Vaccination makes sense. But to force all these different small businesses and big businesses to close down, it just doesn't make sense. And we're not doing the right thing. Anyway, that's my argument. Thanks for joining us, Chuck. I really appreciate it.
Thank you, Brian. And I'd like to thank everybody and have a great holiday over this time. And please remember your small businesses in your community and support them, from restaurants to bookstores to health clubs.
Thanks, Chuck. Appreciate it.
Thank you.